So, where does NMES come into it, the TrueSculpt Flex? Now, we know that there have been papers over the years that NMES can strengthen muscles and improve endurance without the need for loading the joint and muscles as in conventional exercise programs. And this makes the function, this is from a review by Physiotherapy Canada special issue in 2017, this makes the functional phase less painful and shortens the rehabilitation time. There's also a psychological benefit to the patient who finds the functional phase painful, frustrating, and demoralizing. They're out of work, they can't get back to work, their family time is disrupted, everything is disrupted. The other thing is neuromuscular electrical stimulation can also be used in treatment of chronic disease, obesity, neurological disease, aged care, and so on, but I'm focusing on orthopedic rehabilitation. So, we have the problem. The patient's had a successful operation, the surgeon's done his job, but he's hit a brick wall. Why is this? Is it just because of pain, and some patients can't tolerate it, and the physio's doing their best, or the physio's not good, and we try and find all sorts of excuses as to why these patients aren't progressing. What we are coming to realize more and more and more is that there's something called arthrogenic muscle inhibition. I don't know where the picture's gone. There was a nice diagram of a muscle. Can we? Anyway. Arthrogenic muscle inhibition, that's a reflex that occurs when a joint is injured. And unfortunately, the picture is not up there. That picture is not up there. But what happens is you get a signal that gets sent to the brain, and then the brain processes it and sees that this is a painful joint, and it then sends a signal down to the muscle, and it tells that muscle to turn itself off. Now, that's how the brain works, but some of us will say, I just want to push through the pain, and I'm just going to keep walking and doing stuff. And over countless years of evolution, there is another mechanism whereby we have a reflex where the signal that goes to the brain also goes to another nerve inside the spinal cord, and that nerve then blocks the nerve where the signals coming from your brain tell your muscle to work. So this is a reflex caused by a painful joint that inhibits the muscle. So it's a protective mechanism, but after joint injury can become a limitation during rehabilitation. Now, how can we overcome this? How can we get signals to the muscles to get them to work before they waste away? Now, we have to understand how our muscles function. Now, if you have a look here, you'll see there's 3 columns. On the left, there is the column where the muscles are made up predominantly of type 2 fibers, and on the right, predominantly type 1 fibers, and in the middle, there's sort of a mixture of fibers. Now, type 1 fibers are the smaller fibers. They're fibers that can work for hours and hours, and they're the ones that basically keep us alive, your abdominal muscles and your intercostal muscles between your rib cage to keep you breathing. And these just function and allow you to do a bit of walking, your glutes and your soleus, your calf muscles, so you can walk and you can breathe. These muscles, on the other hand, these are the muscles that are needed for fast, explosive actions, for jumping. So millions of years ago, if you wanted to run and catch your food, or if you wanted to throw a spear, your triceps, your biceps, or if you wanted to catch them, your pecs. These are the strong, powerful muscles, and these are the muscles that are predominantly affected after injury. These are the muscles that little gateway in your spinal cord, the arthrogenic muscle inhibition reflex, stops those fibers, because you still have to be able to move, you still have to be able to breathe, but you don't have to have that power during the recovery phase. Now, in most people, as time goes on, the reflex decreases, and these signals that we're trying to get through to the muscles from our brain, the gate opens and the signals get through, and we can start our rehabilitation program. But until that happens, we have a problem. Now, this is how we overcome this problem, by using NMES, neuromuscular electrical stimulation. So what TrueSculpt and the other devices do is we take the handpiece, as you've all seen, and we put it over the muscle group that we want to get working. And that's the benefit of the machine, is that you can target muscle groups, especially for the knee. You want to get this muscle on the inside here to stabilize your kneecap, or you want to get the bigger muscles to strengthen the extension. So the handpiece will then either stimulate the nerve, oops, sorry, got to get used to this one. The nerve which makes the muscles function, so it's actually bypassed the little gateway. You don't need a signal coming from the brain down to here. It just short circuits it and stimulates the nerve, and then it also directly stimulates the muscle. So that activates all the muscle fibers, the type 1 and type 2 fibers. So that's the theory. Does it actually work? Now, there's been some papers out there, and there's been a lot of controversy as to whether this does actually work. Now, having been on this machine, which is a state-of-the-art machine, a lot of those papers from pre-2018, 2019 really were not using machines that worked particularly well. You have to choose your machine. Now, this is a very exciting paper. It came out in August 2020 from the University of Vermont in the United States, a randomized blinded trial that showed histological, in other words, evidence under a microscope that NMES does reduce skeletal muscle atrophy in type 2 fibers and preserves contractility in type 1 fibers. Now, what they did was they had patients underwent ACL reconstruction. That's a reconstruction of the anterior cruciate ligament, common injury. Common problem afterwards, the quadriceps disappear. Some people more than others. And studies have shown that some people, even after 2 years, this AMI reflex is still working, still preventing these signals from getting down to those muscles. And in that time, those muscles just disappear, and very difficult to get them back. So this was a study, and they had a look under the microscope, and for the first time, we've been able to demonstrate histologically, in other words, under a microscope, that it has a benefit after ACL reconstruction. Now, well, I said that was an exciting slide. I think this is an even more exciting slide. What we have here is a nerve. The signal comes from your brain, and then it stimulates this nerve, and then this nerve sends a signal down to your muscle and makes your muscle contract. Now, as we age, this connection between the nerve fibers and the muscle begins to deteriorate. It wastes away. That's unfortunately a function of aging, whether that's just the aging process or whether because we don't use the muscles as much. And I fear that this is actually beginning to happen in people younger and younger and younger as we become more sedentary and don't challenge ourselves. What the body doesn't use, you lose. So this is what happens as we age, is that the junction degenerates and loses its function. Now, this is an animal study from the University of Nottingham, and this was only published in January last year. Very recent study. It's not done in humans, this is an animal study. And what they found is that by using NMES, this nerve, the endings start to regenerate. Neurotrophic factors are released, it starts to regenerate. These clever people, I don't know what these numbers and things are. The people who work this out are absolute geniuses. They're far smarter than orthopedic surgeons. But this, for me, is an exciting slide. So NMES seems to work by bypassing that gate and stimulating the muscle directly, and then also possibly in people who've had long-term wasting or elderly people by regenerating that. Now, there has to be another mechanism, because I've been on the machine, and all the patients who've been on the machine tell me the moment they get off the machine, they feel different. Now, your muscles can't increase in size in 15 or 45 minutes, and we can't regenerate the nerves. And I think what happens is that your brain gets feedback from the muscles to say, hey, I'm working again, and that gate is slowly opened. So immediately after you've come off that machine, you do feel different. You feel a lot more powerful. And that, I think, is a third mechanism, although I have no clinical evidence for that. But that's the only way I can explain the different feeling you have once you get off the machine. Now, a clinical review of AMI. This here is from December 2021. It's a couple of months old. People are starting to look at AMI in far more detail than what they did before. And it's very difficult to convince orthopedic surgeons about this. I've spoken to my colleagues, and a lot of them poo-poo this kind of stuff. No, just send it back for more physio. And I say it doesn't work. But we are now starting to look at it more and more. And this review came to the conclusion that the continued widespread observations of post-traumatic muscle wasting suggest that interventions to treat AMI are not being successfully integrated into clinical practice. And the authors of this review said, you may not have seen AMI in your practice, but it has seen you. And I am seeing it more and more and more, and I think we've missed it in the past and blamed patients and blamed physiotherapists for lack of progress. So furthermore, the review had a look and it highlighted the clinical relevance of AMI. It's been missed by surgeons for years and years. We just have not been aware of it. Provided an updated evidence for the use of clinically accessible therapeutic adjuncts to treat AMI. And what they found, the bottom line was the use of NMES in conjunction with therapeutic exercise helps to minimize strength and muscle volume loss in the early phases of recovery and improves voluntary recruitment of motor neurons. And the clinical bottom line, again, the use of NMES is the most beneficial during early phases of recovery. And this is the trick to decide when to put people onto this machine. You don't want to go too early, but you also don't want to go too late when a lot of the damage is done and very difficult to reverse. Now, the TrueSculpt Flex muscle stimulator, a lot of it's been discussed in more detail than what I'm going to discuss it, so I'm not going to go through it again. Importantly, the TrueSculpt Flex muscle stimulator stimulates the type 2 fibers first, before recruiting the type 1 fibers. It targets those fibers specifically that are important to get strength and function back. These are the fibers that when you're walking, you can walk with your type 1 fibers, that's fine. But when you stumble or trip, what you want is those type 2 fibers to kick in, and they kick in rapidly and very fast, and they're very powerful. But if those type 2 fibers aren't there, you can have all the rehab in the world, you can cycle, you can walk, you can swim, but if you're not stimulating the muscle to the point where you're getting micro tears and those type 2 fibers are healing and strengthening, it's very difficult to progress. And that's the beauty of these muscle stimulators, that they can overcome that. We know all about those things. They've been discussed at length before. The 3 different modes are very useful. So all patients are different. You can decide if you want to start with tone or prep or sculpt. We usually just go straight to tone because most patients have got through this first couple of weeks, but I think a few patients may actually benefit from prep if they're very weak. This is how they heal, and the muscle fibers are challenged to the point where they undergo micro tearing, and as they heal, they strengthen. And you can't do this without actually challenging the muscles to the point of exhaustion. And in post-surgery patients who've got painful joints and tissues that are still healing, you don't want to re-injure the joint, you don't want to disrupt your repair, and this is the benefit of using the stimulators. Now, for the guys in the back who've fallen asleep, this is the interesting slide. The treatment releases hormones. So when you challenge your muscles to the point where they micro tear and then re-heal, a whole lot of factors, and there's growth hormones and insulin and testosterone, and these are released and they aid the healing and growth of the muscles. Now, I've been on the machine, and what I noticed was it just didn't affect the muscles that were treated, but your other muscles are a lot stronger as well. I'm a keen golfer. I golf twice a week. I walk every time. But I was finding that 16th, 17th, 18th hole, I was getting tired. My legs were getting tired. But after having had my abdomen done and my upper arms done, suddenly that tiredness was gone. I wasn't doing anything different, but I no longer get that fatigue. And I can only attribute it to the difference that the strengthening your muscles releases these other hormones. The other thing I've noticed when I operate, when you do shoulder arthroscopies, and I do mainly shoulders and knees, at the end of an operating day, I would get terrible pain between my shoulder blades. It was really uncomfortable. And since having had my core improved and my posture improved and just standing better, it's gone completely. I've done nothing different. So it's not just the muscles that you treat. I think there's a benefit to the body as a whole. The greatest benefit, and I don't think anybody's mentioned this, and the patients say to me, aren't I going to be sore after this? Because I tell them what it does, and 45 minutes on the machine is equivalent to 54,000 sit-ups, and they're scared. They think they're going to be sore, and you can reassure them, no, you're not going to be sore, because the treatment is aerobic and lactic acid doesn't build up. That horrible pain that you get from lactic acid buildup is not there. You do get a bit of delayed onset muscle soreness. It's really minor. nothing more than Panadol or paracetamol for a day or two, but most people don't even need anything. They just feel like, yeah, I had a good workout, it feels good.